This program is made possible by American Senior Benefits Wichita is all about your peace of mind. We specialize in asset protecting, safeguarding your health, planning your estate, and preserving your freedom of choice. We're here to work through all of this with you. American Senior Benefits Wichita proudly supports PBS Kansas. The Candle Club, a place where friends, food, and music come together. Currently, we offer live entertainment every night except Sundays. Enjoy our delicious specialty appetizers and the Candle Club Signature Prime Rib. More about upcoming events at candleclubwichita.com. Home Health and Hospice of Kansas is a locally owned and community-based provider. We offer quality health care to our patients and families, complete with love, warmth, and compassion. We'll take care of all of the details for you. For more information, please visit kansashomehealth.com. Welcome to Cedric Plaza Retirement Community. Our living options are designed to suit your specific needs and activities that you're sure to love. We believe you'll be able to see yourself here, enjoying time with friends and family. For more information, visit cedricplaza.org.
Welcome to Empowering Seniors. I'm your host, Catherine Ambrose, and today we're talking about foot care. I'm here with Dr. Sanchez. Doctor, thank you so much for being on the show.
Thanks for having me, Catherine.
So we've wanted to talk about foot care for some time because you've got to be good on your feet. What caused you to go into the specialty?
There's a big reason for it. My dad's a pediatrician. He's been in the medical field for over 30 years, and right next door to where he worked was a podiatrist, and I was shadowing a bunch of different doctors, and I got to shadow this podiatrist, and you know, you'd see people come in, they'd be stumbling in just because of the pain that they were in, and we would find ways to make them feel better, be able to walk out of the clinic easily without the pain that they were experiencing. Mm-hmm. And I had seen a lot of doctors, I had shadowed a lot of doctors, and I hadn't seen something that was so kind of gratifying that you could, over one visit, completely transform the pain that this patient probably had been in for the past several months. Mm-hmm. So that's kind of why I got into it. I really liked what they did. I thought that what they were doing was essential and was really helping a lot of these patients out. And I mean, we walk every day, or we hope to, mm-hmm. and to just struggle on something that you kind of take for granted and to be able to help people kind of get in and out, day in and day out, was really, really kind of gratifying. I kind of fell in love with it.
Do you find sometimes that patients are hesitant to come to a podiatrist the first time?
Sure. I think, and we hear this all the time. They call us up, oh, I've got the worst feet you've ever seen, or these are the worst nails or the worst calluses. Trust me, we've seen it all. You're not going to surprise us with anything, and I bet you we'll be able to make you feel better. And I don't know what it is, but I know that majority of patients that do come in after seeing us do feel a lot better, feel a lot more encouraged, and walk around a whole lot easier after a visit.
It must be a relief to know that the issue that they're struggling with, that it's not uncommon.
Yeah.
And it can be addressed. What are some of the things that you've noticed can make a big difference for people?
Things that I've noticed are the type of shoes that they're wearing. I think all of us, no one really shows us what type of shoe we should wear, whether we need an insert, whether we have a certain deformity on our foot, why we develop certain calluses, why our nails thicken up. We really have no idea. No one really kind of teaches you, or you don't really think about a past show or movie that, really gave you the basis of anything. Mm-hmm. And shoes and inserts have come a long way over the past 20 years. So I think a lot of people don't really understand what a good shoe is, what a good insert is, even the type of foot that they have. Do I have a flat arch? Do I have a high arch? Why is this bump forming here? Why is this toe contracted this way? Is it something I did wrong? Was there a previous trauma? Or maybe it's something that's just gradual wear and tear. Sometimes people have arthritis or spurs that naturally form. And to have someone, or to at least get some input on what I can wear, what is going to help me out, just to have some little guide or some little level of reassurance, can be pretty helpful, I think.
What are some of your tips about shoes?
Shoes, it's tough. I would say the biggest tip I can kind of give a patient, especially at the end of the day when you are shoe shopping, I would go at the end of the day because our feet tend to swell. You want to find a shoe maybe with a little bit more room in the toe box area, the front of the shoe, just because a lot of our patients are kind of older, they have some bunions, sometimes hammer toes or thickened nails, and if the shoe is too narrow, it tends to put a lot of pressure, a lot of strain on those nails or those deformities and causes pain. Sometimes they can cause calluses. The other thing is wearing shoes. We have a lot of patients that their entire life they never wore shoes, and we have diabetics who have poor sensation or poor circulation, and sometimes they're walking around barefoot and they accidentally step on something without realizing that they did step on something, and it turns into a nasty little wound or an infection or sometimes worse. So wearing shoes seems to be the most basic advice I can give a lot of our older patients. But the trouble is, kind of like we discussed, finding the right shoe. And a lot of times, you know, having a patient come into the clinic, us evaluating them, trying to figure out their foot type and what shoe's going to work well for them is half the battle. Because I could tell you, hey, do this shoe or focus on that brand or focus on this, but every foot is pretty unique. Not one insert fits all, not one shoe fits all. And so a lot of times getting a good exam done and seeing the type of deformities or the type of foot that they have will give them a better understanding, okay, I can fit in this shoe, or I can wear this type of shoe, or I should stay away from that shoe.
I know that if you have something wrong with your foot, that can be a problem that goes up your leg, can be an issue that affects your back, and so you need that good foundation. Shoes that are too short, what kind of problems can that cause?
A lot of times, shoes that are really short or poorly fitted, people will get little calluses at the tip of their toes. And a lot of patients that we have, when they have poor sensation, aren't able to feel that. And these calluses can get big enough that they become wounds, or worse, become infections. And so what I've noticed is shoes that are a little too narrow or too short in the front just tend to lead to a lot of pain, sometimes even loosening the nails to the point where, we get infections and whatnot, and something more drastic needs to be done.
Speaking of nails, there's all kinds of nail issues, I would imagine. What are some of the nail issues that can be addressed in the doctor's office?
So we get a lot of people think it's a fungal nail, or maybe the nail is loosening, or even ingrowns. We see a lot of ingrown toenails here in the office. And that's because people don't have a good idea of how to trim the nail. Sometimes they kind of keep trying to dig an ingrown out and make something that maybe wasn't too big of an issue into that big issue, or create an infection. Or sometimes they go to a spa or get someone new to trim their nail that's never really seen their foot or their nail type, and we run into some little issues. So a lot of times when we have problems like that, we can trim those toenails either more aggressively if there's an infection, or if this is something that they've had that kind of keeps reoccurring, depending on the patient, we could remove those ingrowns permanently, depending on the surgical procedure, depending on the patient.
I would imagine that would relieve a lot of pain in future.
Absolutely. And I think depending on the nail, sometimes people think it's a fungal nail. A lot of times they've been through multiple treatments and they don't know why the nail hasn't gotten better. We at the clinic could take a couple nail specimens, send them to lab, and kind of confirm whether it is a fungal nail, and then based on that, we could kind of recommend, oh, you'd qualify for this antifungal treatment or this antifungal topical polish, things like that, just to get them pointed in the right direction.
I'm here with Debra Trevett. She's an RN and she owns Toe Truck. She's an expert on foot care. Debbie, welcome to the show.
Thank you, Catherine. Thank you for having me.
I hear you have a list of at least 10 items that you'd like to share with your clients. So tell us a little bit about those tips.
I will, thank you. The first tip is I start on the top. I start with soaps. One of our problems as we age and with a lot of people is the dryness, especially our lower legs and our feet. And so the first question I have if I see that dryness is, what kind of soap are you using? Soap is important because soap has a pH balance. It can either be more basic and harsh in drying, or it can be balanced, not acidic. So if I see the drying and inquire about their soaps, I might recommend something with a little bit more moisture. Now your Dove body soap, body wash is very balanced. It's pH balanced. There are other brands that are also balanced that are like your shea butter, also some of your basis or your Cetaphils. I don't like to say what to avoid, but sometimes if you're having the drying of the skin, you might be using a more basic soap. Things that maybe say antiperspirant or deodorant, those things zone in on a drying factor, as well as your perfume soaps will have more alcohol, which also dries.
Good tips there.
Thank you.
Soap, and then I'm assuming lotion if you're trying to moisturize. So what are your ideas regarding lotions?
For lotions, as well as the soaps, is if you're happy with your skin, I don't recommend you do anything differently. And so my recommendations are if you think you would like to have softer skin or less dry skin. For the lotions, one of my favorites is the CeraVe. There's an ointment, which is more of a petroleum texture, so that's a heavier texture, but if you've got the real dry skins and dry lower legs, putting on the CeraVe, even a couple of times a week, you'll notice a big difference. And it's very similar to your Eucerins or your Gold Bonds, those kinds of things. I caution, again, the ladies as well as the gentlemen, if you have a perfumed soap or a perfumed lotion, that you might not be getting the moisture that you would like. So yes, we start with the soaps and then the lotion.
And what do you recommend regarding when you put lotion on? Are there things to avoid or things to do?
Yes, especially on your feet in between your toes, is you don't want to leave the lotion in between your toes. Between your toes is called the web space, and if there's lotion left in there, one of our common foot problems is fungus, and that can lead to our yellow thickening toenails. And if you've got your lotion stuck there in your web space, the fungus loves warm, moist areas. So I always recommend toe flossing. And what I mean by toe flossing, I love baby wipes because baby wipes are soft, and it really is taking your baby wipe and you're flossing in between your toes. Now with all those things, I know the average person is probably saying, well, that's all good, but I can't get to my feet. And I do realize that. You know, as we age, you get a little bigger around the midsection. We can't see as well. Our hands they don't work as well, and we can't bend over. And so I know foot care is very, very difficult. That's why I say to do the best you can. If you've got somebody to help you, even again, without constant bathing, even though I recommend you do bathe your feet, wash your feet daily, again, the baby wipes can help a lot, just keeping clean and dry and in between those toes.
And maybe someone at home can help.
Yes.
Or they can contact a service that comes out to the home. So what is that experience like for people?
In the Wichita area, I always recommend that there's podiatry groups to contact, there's nurse practitioner groups, there's also, you can check with your senior centers, because some of your senior centers, have services right there, as well as Department on Aging. If you're looking for a certified or a specialized nurse, there's a group of nurses, if you can believe. It's called the American Foot Care Nurse Association. So if you look that up online, that will tell you nurses in your area that have been specialized and that do come out to the home. So your nursing visits in the home, you should expect that the nurse will look at the structure of your feet for any areas of concern structurally, look at the soundness. Myself, I inquire about the shoes. I, again, inquire about the soaps and the lotions. And as a nurse, part of what we do is education. And, you can get your good foot care, but just educating you then on prevention.
We're here with Glenn Lygrisse. Glenn, thank you for being on the show.
Good to be here. Thanks for inviting me.
So feet are important.
Yes, that's a mild understatement, so to speak, yes.
And how did you find out about the type of foot treatment that's available?
Debbie came to our senior citizens group at our church and did a presentation. And it wasn't long after that I said, I need her services. I have had some health situations that warranted that. One is calendar disease. The other is that I am diabetic, I'm a cancer survivor, and I also have heart disease. So combine all of that, I felt like it was imperative to have good foot care.
Good for you for taking action, because probably there were people that thought they should have her over and maybe didn't.
I think people have a tendency to be recalcitrant to call someone like Debbie because they somehow feel like, oh, I should be able to do this myself. But there's no substitute for good professional care, and you just can't mess with your feet having major problems. Small problem can turn to big problem.
How often do you have her come?
About every 6 weeks. And I have to manage that between travel times and things of that nature, but approximately about every 6 weeks.
And have you noticed a difference?
Absolutely. The other thing that she does, not only just the immediate care, but she looks for impending signs that could be problematic down the road. Last time she visited, she said, I notice you have a little red spot on the top of your foot. She suggested I change insoles in my shoes. I did that, and that's helped that problem. So it's not only immediate care, but preventative care as well.
That's fantastic. So if someone is hesitant to call a service to come to their home, what would you tell them?
Do it, and do it sooner rather than later. Don't wait till you have a problem. Do it to prevent problems that can occur. And then those problems, once they start, can exacerbate and get much worse.
And prevent a lot of misery, I'm sure.
That's right.
And you need good feet to get around.
Absolutely, yeah. It's one of those things that sometimes people want to put off because of they feel like, oh, I can do this myself. But again, a professional foot care person can see things that I can't see for myself. They can recognize potential problems that I don't recognize. So I just think it's one of those smart things to do.
Sounds like it. Well, thank you so much for being on the show.
No problem. Thank you.
One of the things that I do talk about, as I mentioned, are shoes. And shoes are so difficult. One of the things to remember when you go buy shoes, A, you should go later in the day. Main reason, your feet are the biggest. B, take your socks that you plan to wear with those shoes so that you have the right socks on with the right shoes. Try on both shoes. And always remember, as we age, our foot can drop and get bigger. So because you wore a 7 all your life doesn't mean you're still wearing a 7. So make sure the shoe is comfortable. Make sure it fits snugly. Another thing that you can consider when you look at your shoe is just hold the shoe up and push the shoe. You should maintain all along here, should not be able to crunch all the way over. Crunching that shoe all the way over, then you're not getting the support that you need right here on the arch of your foot.
Okay, so I can take it like this and bend it.
Yep.
So you're looking for that straight
Yep, you're
line.
looking for support all through there.
Okay, and why is that?
Because you want the shoe to stay on your foot and to follow your foot.
So Debbie, when people have a foot care specialist help them with their feet, what are some of the surprising things that come from that?
I get calls, a lot of calls with people. First, they often can call 2 or 3 times because they're so embarrassed about how their feet look. Or some of them, they know their feet hurt, but they actually can't even see their feet to know what is wrong with the feet. You know, anymore I don't find any surprises, but what I do know is with good foot care, they're totally amazed in how they feel. You know, and then you also have the corns and the calluses. And one thing I want to always mention to them about their calluses and their corns is to avoid the pre-medicated, the medicated corn pads and all that, and or the, you know, it's going to remove your corns and your calluses, yeah, because it's acid. You know, you're putting acid, and it might remove it, but you also can damage the skin around it. So for your corns and calluses, physicians can remove those with scalpel, but the thing you always have to remember is that's caused from friction. As long as you're keeping the same shoes or doing the same thing, you're going to have the same results. And another little tip I always tell, and some people laugh, is If you want to attempt to remove your own calluses, I recommend the file is my best friend. So you have a file. I like the 180 grit file. You can do 100, but it's more coarse. And when you can get out of the shower when your skin is moist, simply just keeping that callus, just scraping off that skin on a regular basis, or after your local foot care specialist has helped you, will help keep that reduced. Once your nails are where they should be, if anyone can help you, you can truly maintain nails with a file for so long. Not only the end, I always remind them as your nails are getting thicker, you can always file the tops of your nails. We forget that we can use a file on the tops also. And it's a service. It's a comfort service, and you enjoy it, you know, and you deserve to do that for yourself. And if it can help you to walk and to maintain healthy feet. You know, another thing I do talk to them about is I challenge them to do foot exercises. You know, throw a towel on the floor and practice picking it up with your toes. Do that during commercials, but keep those toes and all those muscles and everything in your foot as healthy and flexible as you can to avoid future problems.
Well, Debbie, thank you. That was very informative. And we didn't get to all 10 tips, but what you have shared with us, I'm sure is very helpful.
Well, thank you. Thank you again for having me.
And now back to Dr. Sanchez. And you mentioned that things have really changed over the last several years, and people may not be aware of you know, what the latest and best advice is. And so coming to the foot doctor to find that out, that makes a lot of sense. How often do some patients come?
So most insurance companies are going to cover a visit like nail care or callus trimming every 9 to 10 weeks. So usually we see them every 9 to 10 weeks. We trim nails, we trim calluses. Main thing, especially with our diabetics or the patients that we routinely see for nail care and callus care, is we check circulation, we check sensation, things like that. Those are our big things we worry about. If you can't feel something, a lot of those calluses turn into wounds, or if you have poor circulation or vascular disease and you do get a cut or you do get a wound, a lot of times those wounds won't heal. And we're able to evaluate that and at least get you referred to maybe the right doctor, someone who can at least help your circulation, so that if you have had wound healing problems for years, we can maybe accelerate that or maybe improve your circulation quite a bit.
I would imagine that addressing those issues is good protocol for fall prevention. That maybe you can help prevent some falls by good foot care.
Absolutely, absolutely. And patients, you don't really realize it until, you know, if you had these thickened nails or these painful calluses for years and you come in and you get them trimmed or trimmed out, you really realize walking out the door, wow, I was walking completely different for years. So you'd be surprised, some of the patients, kind of the way they walk out that door, they feel more stable, probably going to have less falls down the road too.
I'm just curious, do you ever give consult on walking properly or walking differently?
Yeah, absolutely we do. Or a lot of times, sometimes the way you walk, you think it's out of the ordinary, but it might be just right for your foot type. Sometimes we can get you a custom insert that allows you to, we'll say, walk more regular. Or sometimes people, depending on their deformity, depending on, I had a previous trauma or car accident, I've never been able to walk right since, we can get patients into a shoe or sometimes a brace or sometimes some physical therapy that can make them feel more stable and walk around a whole lot more easier.
Very good. And it looks like you have a show and tell item or a couple of items.
So we kind of have some medical grade inserts here. And like I said, not one insert fits all. Here's kind of one of our basic little medical inserts here. It's got a nice little soft material here on the top, kind of provides a lot of cushion for a lot of patients. And then here on the bottom, a nice little rigid little arch support just to kind of keep the arch level and well supported. And we have some patients that will start out with something like this. We can pad up the arch area, kind of build it up if you have a higher arch, kind of lower it if you have a flatter arch, or just try to figure out, oh, you're putting a lot of pressure on this portion of the foot. Let's kind of pad that area up so that you're not putting as much pressure and you're a lot more comfortable. These inserts tend to last patients about 9 months to even a year. We have some custom inserts here. Like I said, not all feet are created equal, but sometimes we can make a custom design here in the office. We'll take a mold of the foot, and we can modify that little insert just so that they have a whole lot more custom of an insert that'll last them. These last about 5 to 8 years, so they last a whole lot longer, and there's something that basically designed for your foot. I kind of look at the inserts kind of like a pair of glasses. You know, a lot of times we can't see well, we put our pair of glasses on, that kind of helps us out. Walking is really important for us. So when you have the right, device to kind of help you walk a whole lot more normal with a lot less pain, you're going to walk a lot easier. You're probably going to have a lot of less knee pain and not as much, back pain or even hip pain.
And we have viewers all across the state of Kansas. How do people go about finding a good foot doctor?
You can search online. There's a bunch of good reviews. People are posting reviews, doctors that they've seen. Or sometimes you can even look up, there's Kansas Podiatric Medical Association online. And a lot of times you can put the area that you're in here in the state, and they'll kind of show you a couple of people closer to your area. So you can find a podiatrist pretty easily online nowadays and look at their reviews and see if there's something that they'd be able to help you out with.
What are some common mistakes that people might be making at home? They might think they're doing something good, and maybe it's causing an issue.
I think a lot of patients tend to kind of soak their feet quite a bit. And that's not a bad thing necessarily, but I kind of recommend maybe 2 or 3 times a week you're soaking your feet, maybe with a little bit of Epsom salts for 5 or 10 minutes. The more you tend to soak your feet, you tend to kind of over dry the skin. And when you over dry skin, you can get some built up dry tissue, sometimes even little fissures that occur in the skin, or sometimes wounds. So I would just kind of say, don't tend to overdo it. Bacteria tends to like wet environments, and the more you kind of have the feet kind of soaked and kind of with this wet tissue, you're probably going to tend to get infections down the road.
And any other words of advice for people watching at home?
I'd say come see a podiatrist if you're having a lot of foot care. You're not alone. A lot of people have the same issues. So I think there's ways to at least make patients feel a lot more comfortable without doing something super aggressive.
Yeah, so they're just coming to get their feet checked and not to be fearful that they're looking at a surgery for sure. Thank you so much, Dr. Sanchez, for being on the show.
Thank you.
And thank you for watching. If you have questions about this topic or any of the other topics that we cover, please reach out to us. You can reach me at 316-686-4500 or email me at empoweringseniors@kpts.org. Until next time, I'm Catherine Ambrose, and this is Empowering Seniors.
This program is made possible by American Senior Benefits Wichita is all about your peace of mind. We specialize in asset protecting, safeguarding your health, planning your estate, and preserving your freedom of choice. We're here to work through all of this with you. American Senior Benefits Wichita proudly supports PBS Kansas. The Candle Club, a place where friends, food, and music come together. Currently, we offer live entertainment every night except Sundays. Enjoy our delicious specialty appetizers and the Candle Club Signature Prime Rib. More about upcoming events at candleclubwichita.com. Home Health and Hospice of Kansas is a locally owned and community-based provider. We offer quality health care to our patients and families, complete with love, warmth, and compassion. We'll take care of all of the details for you. For more information, please visit kansashomehealth.com. Welcome to Cedric Plaza Retirement Community. Our living options are designed to suit your specific needs and activities that you're sure to love. We believe you'll be able to see yourself here, enjoying time with friends and family. For more information, visit cedricplaza.org.